I am Dr. Vaibhav Kucchal, former professor and head, Department of ENT, Government Medical College, Haldwani. Now I am running my own hospital, that is Garb ENT and Henech Hospital. I am working as director as well as senior consultant.
Doctor, what is tinnitus and how does it manifest in individuals who experience it?
Tinnitus is literally meaning ringing in the ear or buzzing sound in the ear. And the patient, they do come up with the same complaint, that is, they say something is roaring in their ear. Sometimes they complain of roaring sound in the ear. Sometimes they say it's a buzzing sound or something crawling sound in their ear. So that is the usual complaint. And one thing important about the tinnitus is it's a symptom, it's not a diagnosis.
Doctor, what common causes of tinnitus and are there any risk factors that may predispose someone to develop it?
Yes, if we talk about the common cause, the most common cause for the tinnitus is presbycusis. That is the aging phenomena. After the age of 65 years, as the hearing loss increases due to the inner ear degeneration, the tinnitus happens. But there are lot many causes for the tinnitus, such as noise-induced trauma, it could be Meniere's disease, it could be the tumors of the inner ear or the CP angle tumors, or it could be associated with other systemic illness such as hypothyroidism, or it could be because of drug induced such as anti-tubercular therapy. And if we talk about the predisposing conditions, it is usually the loud sound or the you can say sometimes even the anxiety. The patient, they do have the tinnitus.
What are the different types of tinnitus and how do they vary in terms of severity and treatment approaches?
Tinnitus, if we talk about the classification, it is objective as well as subjective. So objective is the patient says that he is having a ringing in the ear, and with the help of a tube, even the examiner can or the attendant can listen the sound. So that is the objective tinnitus, and commonly we see in the glomus jugulare or AV malformation. Then we do have a subjective tinnitus, that is the most common cause or most common group of tinnitus, where the patient, they do come up with the ringing in ear. The attendant or the examiner is not able to appreciate the ringing sound.
Doctor, how is tinnitus diagnosed and what are the typical steps involved in determining the underlying cause?
As I told you, tinnitus is a symptom, not a diagnosis. So first thing that we have to do in treating the tinnitus is we have to elicit the cause for the tinnitus. And for eliciting the cause, first we have to take a detailed history. So that will give us a clue what exactly is the cause for the tinnitus. Then we do the local examination along with the systemic examination, and then of course we go with the audiological assessment of the patient, and if required we go with the radiological investigation of the patient, including the MRI of the inner ear.
What are the potential complications or associated conditions that may arise from untreated tinnitus?
As I told you, we have to see what exactly is the cause for the tinnitus. Suppose if it is an inner ear tumor, so if we don't treat it, then it could be a devastating thing for the patient, because as the tumor grows, yes, the patient do have the complications of the you can say brain involvement. At the same time, if it is a presbycusis which is responsible for tinnitus, then it may not be that detrimental to the patient. Only thing is, it is going to have a psychological impact or a you can say that daily life is going to be hampered. The patient is perturbed. So that is one thing that is going to be there.
What treatment options are available for managing tinnitus and how effective are they in alleviating symptoms?
See, when it comes to treatment or management protocol of tinnitus, first thing we do is identify the cause. So accordingly, we have to treat the cause. If we are not able to identify the cause for the tinnitus, or if it is a presbycusis, then or it is a noise-induced trauma. So first thing is we have to avoid the loud sound. That is the lifestyle modification. So first thing that we ask the patient is to modify the lifestyles, such as has to avoid the excessive loud sound, has to avoid you can say coffee, even smoking, etc. needs to be avoided. And then besides this, if patient is you can say habitual user of mobile, then we say it should be avoided. Loud sound exposure should be avoided. If he's in the, you can say, army or in the noisy area, then we recommend the earplugs. Then next thing we do is, after modification of the lifestyle, then we try to treat the primary cause. What exactly is the cause for the tinnitus, and then we go with the pharmacotherapy. Pharmacotherapy that comprises routinely ginkgo biloba. We give niracetam along with the methylcobalamin.
Are there any lifestyle modifications or habits that individuals with tinnitus can adopt to help reduce the severity of their symptoms?
Healthy lifestyle. Healthy lifestyle means regular schedule. Early morning get up. If the patient is going to get up early in the morning, have a regular exercise schedule and go to bed at a regular time interval. Say, don't go too late. So that is going to help. That is first thing. So normal sleep cycle is very important in, you can say, managing tinnitus. Then of course regular exercises, avoiding, you can say, smoking, then excessive tobacco use in any form, loud sound should be avoided, and excessive use of mobile and earphones and earpods should be avoided.
Doctor, how important is it for individuals with tinnitus to protect their hearing, and what steps can they take to prevent further damage?
To avoid further damage to the hearing as well as the increasing symptoms of tinnitus, we recommend whatever is the predisposing condition for the tinnitus should be avoided. So if it is a Meniere's disease, we recommend don't use excessive water, avoid caffeine, reduce salt intake. That is going to help. If the patient is having is a factory worker who is daily exposed to loud sound, avoid working in the loudly, or you can say very detrimental sound area. So that needs to be avoided. So if those who are working with DJs, discotheque, they do have a problem. Army people, those who have a regular shooting practice and all, or having artillery gun firing, we recommend uses of the earplugs. So that is going to help them.
Are there any alternative therapies or complementary treatments that may be beneficial for managing tinnitus?
If we talk about the alternative therapy, yes, yoga do have a role, because yoga I always take is as a exercise, a module of exercise, so that makes a person fit. So as I told you, regular exercise schedule and regular daily routine is very helpful for managing tinnitus. Besides this, yes, you can. Some people, they do good with the tinnitus markers as well.
Doctor, what impact does tinnitus have on a person's quality of life, both physically and emotionally?
If you ask me, this question is a very tricky question. If we see 100 patients, majority of the patients, they do have a psychological impact, emotional impact on their life rather than the physical impact. If we talk about physical impact, until unless there is some inner ear tumor, or if the patient is having Meniere's disease, yes, then they do have a balance disorders, they have the headaches. These are the complaints, yes. Otherwise, majorly patient, they do have the ringing in the ear along with the impairment of hearing. So these are the two troublesome symptoms to the patient. If patient is having impairment of hearing, yes, sometimes if it is in the younger age group, they are not able to cope up with their daily lifestyle, or you can say the office work, which might lead to frequent changeovers of their jobs. Besides this, then it has got a lot of impact on the emotional aspect, because the patient, they are not able to have a normal sleep. So the sleep pattern is hampered. Because of that, they do have a psychological dysfunction, and sometimes they are on one or the other antipsychotics. Sometimes the people, they are not willing to accept this as a diagnosis. They go to the psychiatrist, and the patient, they feel he's having some psychiatric illness. So that is one thing. Besides this, because of the impaired sleep, they are not able to concentrate on their work. Sometimes they do have a difficulty in driving as well. So we have to keep that psychological aspect quite considerably.
Doctor, How can friends and family best support someone who is living with tinnitus?
The role of family and friends is very important in the management of tinnitus. They first have to accept it. Yes, this is a symptom, and anybody can have this symptom. And the present scenario, even the younger people, they do have. Because if the patient, they do come up with the ringing in the ear and say to some of their family member or the friend, they make fun of that person and they say you are making either you are going mad or you are just befooling or it is nothing. So the first thing that they have to do is they have to accept it and to seek early medical intervention, because if they seek the medical advice, if there is some cause which is reversible, can be treated.
Are there any misconceptions or myths about tinnitus that you commonly encounter, and if so, how would you address them?
The most common myth which I come in my practice is that tinnitus is untreatable. So this is one thing I always tell my patient, it's not like that. We have to identify the cause, what exactly is the cause for the tinnitus. Then we have to pinpoint the management according to the diagnosis. And in our practice, we see that 50% of the patient, they do good with the tinnitus, depending upon the cause for the tinnitus. Yes, some patients, yes, they do come up for a long time with the tinnitus.
Finally, what advice would you give to someone who has recently been diagnosed with tinnitus?
See, if somebody is being diagnosed recently with the tinnitus, first thing is don't lose hope. Be optimistic about it. It's not a thing which is non-treatable. It can be treated. At least your quality of life can be improved. So just seek the medical advice and have a hope that the things are going to be uh, good and your lifestyle is going to be better. Thank you very much. Thank you.